So what is sleeve gastrectomy? As the name indicates, sleeve gastrectomy is the surgery of the stomach. The complete name should be laparoscopic sleeve gastrectomy. And I say laparoscopic is a technique of doing the surgery wherein we make tiny holes on your tummy, and by long cylindrical and tubular instruments we operate. So it should not be confused with laser technique. There is no use of laser in this surgery or in this procedure. So laparoscopic sleeve, thereby we are converting your stomach or the pouch or the stomach into a small sleeve or a small tube. And gastrectomy, gastrium or the stomach, ectomy means to remove. So we cut using stapling devices your stomach into a small tubular form, thereby reducing the capacity of a 2-liter stomach into something of 100 or 120 cc. Or in other words, we are eliminating or reducing the capacity by about 80 to 85% and making it into a small tube. Now what happens? Normally the food travels to the stomach, it mixes with the saliva and it churns. So the main action of the stomach is not digestion but churning of the food and mixing with the salivary juices that is present. In this case, when the stomach is reduced to a very small quantity from a 1.5 liter to about 100-150 cc, their churning doesn't take place. So this food initially with a halt at the pylorus, which is the upper part or the lower part of the stomach, stays there and then rapidly transits into the upper part of the intestine. So the quantity is reduced, it stays in the stomach for a short time and then passes rapidly. The other thing which is going to happen in this is when we remove a part of your stomach, some part of the stomach which is called the fundus of the stomach secretes a hormone called ghrelin. Now this ghrelin is the hunger hormone in your body which acts on your brain to make you hungry. Now when we do this surgery, the ghrelin or the hunger hormone reduces by about 60 to 80%, thereby taking care of your mental hunger. So your appetite, your hunger decreases, your stomach is small so you can take a smaller quantity of the food, and by taking smaller quantity, satiety or the feeling of fullness comes early. So it's not that you wish to eat, you're always hungry and you cannot eat. It simply means that you wish to eat less, and by eating less you feel satisfied and you feel satiety. So sleeve gastrectomy is a brilliant procedure. Of course, it's not as old as a gastric bypass. However, it's still a brilliant procedure for a select group of patients, and we have seen brilliant results with sleeve gastrectomy, especially in young ladies without any metabolic complication, without any related comorbidities. Sleeve gastrectomy just does a brilliant job.